The moment a baby is born, the world expects joy, smiles, laughter, happy tears, the miracle of life. But for millions of new mothers, that joy is interrupted by a crushing sadness, by fear, by guilt, by darkness they never expected. This is postpartum depression. And it's more than just baby blues. In this video, I want to talk openly, honestly, and without judgment about a topic too often whispered in shame. What is postpartum depression? How is it different from the normal ups and downs of new motherhood? What causes it? And how can we treat it? And why do so many women suffer in silence? Let's break the silence. Let's break the stigma. And let's shed light on one of the most common and misunderstood mental health conditions in women, the myth of the happy mother. From movies to baby showers to social media, new motherhood is painted in pastel colors. It's supposed to be magical, the best time of your life. You're told, enjoy every moment. You should be grateful. You'll be fine. It's just hormones. But here's the truth. Up to 1 in 7 mothers develop postpartum depression, and many feel numb, hopeless, ashamed, overwhelmed, detached from their baby. And yet, they smile for the camera, because the world expects them to. This disconnect between expectation and reality makes postpartum depression even more isolating. What are the baby blues? Let's first make an important distinction. Baby blues are normal. They affect up to 80% of new mothers. They usually begin within 2-3 days after birth and last for up to 2 weeks. They include tearfulness, irritability, mood swings, sleep trouble, anxiety, feeling overwhelmed, but they don't impair daily function and they resolve on their own. What is postpartum depression? PPD. Postpartum depression is not the same. It is a clinical mood disorder, and it's more serious, more persistent, and often requires treatment. DSM-5. Definition. PPD is a major depressive episode with onset during pregnancy or within 4 weeks postpartum, though symptoms can begin up to a year after birth. Core symptoms include persistent sadness or hopelessness, loss of interest in activities, sleep disturbance beyond infant-related, appetite changes, excessive guilt or worthlessness, difficulty bonding with the baby, feeling like a bad mother, thoughts of death or suicide, intrusive thoughts about harming the baby, very distressing. PPD can range from mild to severe, and sometimes includes psychotic features. We'll cover that too. Risk factors for PPD. While it can affect anyone, certain factors increase the risk. Biological, hormonal shifts, estrogen, progesterone, thyroid, personal or family history of depression, sleep deprivation, psychological, perfectionism, history of trauma or abuse, anxiety or obsessive compulsive tendencies, social, lack of support from partner or family, stressful life events, financial strain, difficult birth, or NICU admission. PPD doesn't discriminate. It affects women of all backgrounds, ages, and cultures. How is PPD diagnosed? There's no blood test, but there are validated tools like the Edinburgh Postnatal Depression Scale, EPDS. A diagnosis is made based on clinical interview, symptom severity, functional impairment, duration of symptoms. Screening should occur at postpartum visits during pediatric checkups. By obstetricians, pediatricians, or mental health professionals, early detection can save lives. Is it just hormones? Hormones play a role, yes. After delivery, estrogen and progesterone plummet dramatically. But PPD is more than just hormonal. It involves psychological stress, identity shifts, sleep deprivation, biological vulnerabilities. Think of it like this. Hormones open the door. Life stress and emotional factors walk through it. What about postpartum anxiety? PPD often overlaps with postpartum anxiety, which includes constant worry, panic attacks, obsessive thoughts, physical symptoms, racing heart, dizziness, nausea. Many women experience anxious ruminations like, what if I drop the baby? What if I accidentally hurt them? I'm not doing this right. These thoughts can be terrifying and make mothers feel crazy, but they are common and treatable. Postpartum psychosis, a psychiatric emergency. In rare cases, about 1 to 2 in 1,000 births, women develop postpartum psychosis. This is a medical and psychiatric emergency. It includes delusions, e.g., believing the baby is evil or endangered, hallucinations, severe confusion, paranoia, mania, rapid mood swings, thoughts of harming the baby or self. It typically emerges within 2 weeks postpartum. This condition requires immediate hospitalization, but with treatment, full recovery is possible. The impact of untreated PPD. Untreated postpartum depression affects 1. The mother, chronic depression, substance use, marital strain, suicide, the leading cause of maternal death in some countries. 2. The baby impaired attachment, developmental delays, behavioral issues, emotional dysregulation. 3. The family partner distress, older children, affected household dysfunction. That's why treating PPD isn't just for the mother, it's an investment in the whole family's well-being. Treatment options. The good news, PPD is highly treatable. Let's explore options. 1. Psychotherapy, cognitive behavioral therapy, CBT, interpersonal therapy, IPT, supportive counseling, couples therapy, talk therapy helps process fears, normalize emotions, and build coping skills. 2. Medication. Antidepressants like SSRIs, e.g., sertraline, fluoxetine, are safe in breastfeeding. Medications are tailored based on severity and personal history. Always consult with a prescriber familiar with perinatal care. 3. Lifestyle support, sleep prioritization, nutrition and hydration, physical activity, social connection, asking for help without guilt. 4. Peer support groups, hearing "me too" can be profoundly healing. Many communities, both online and in person, offer support groups for new mothers. 5. New treatments, brexanolone and beyond. Brexanolone, Zulresso, is the first FDA-approved medication specifically for PPD, administered IV over 60 hours, promising results. But access is limited due to cost and logistics supporting someone with PPD. If someone you love may be struggling, don't minimize. "You should be happy" is not helpful. Don't pathologize normal exhaustion, but trust your instincts. Ask directly, "How are you really feeling?" Offer to help with baby care, meals, chores. Encourage seeking professional support. Know the signs of a crisis. Your support can make all the difference. A word for new mothers. If you're watching this and you're struggling, you are not broken. You are not a bad mother. You are not alone. You deserve help. You deserve rest. You deserve to feel like yourself again. Asking for support is not weakness. It's one of the bravest things you can do. Motherhood is hard. Postpartum depression makes it harder, but you can get through this and come out stronger on the other side. Final thoughts. Postpartum depression isn't just about mood. It's about identity, connection, survival. It's not rare, it's not shameful, and it's not your fault. The more we talk about it, the more we normalize it, the fewer women will suffer in silence, because bringing new life into the world shouldn't mean losing yourself in the process. Let's care for mothers, not just babies. Let's listen, let's validate, let's act, because healing begins when we tell the truth, even when the truth isn't what people expect. If this video helped you understand postpartum depression, please like, comment, and share. And if you're a mother who's been there or still is, drop A in the comments to let others know they're not alone. Until next time, take care of your mind. And if you're holding a newborn, don't forget to hold yourself too.